Well, good morning. It's 10 o'clock. Let me start by thanking all of you for joining us. I'm Don Williamson, the president and CEO of the Alabama Hospital Association. We're joined today by Joseph Marchant, who is the chairman of the ALAHA board and CEO of the Medical Center. We're joined by Joe Stow, who's the chair-elect of the board and executive vice president and COO of Mobile Infirmary. Peter Selman, the past chair of the ALAHA board and the CEO of Baptist Medical Center South. Laura Grill, the secretary treasurer of our board and president and CEO of East Alabama Medical Center. We're joined today to talk about the challenges that Alabama hospitals face. Across the country, there has been a realization that COVID has created significant and new financial challenges for hospitals. As we were looking at the experience of hospitals over the last 3 years, we continued to hear reports from our members about the grave situations in which they found themselves. A national consulting firm, Kaufman, did a report on the state of America's hospitals in the fall of 2022. But based on that report and realizing that Alabama hospitals were included in that national data, we asked Kaufman to undertake a similar analysis of Alabama hospitals. And we're going to share with you that report today. We're pleased to have with us to make that presentation Eric Swanson. Mr. Swanson is a senior vice president of data and analytics with Kaufman and the lead on both the national and the Alabama reports. With that, Eric, I'll turn it over to you.
All right. Thank you, Don, for that wonderful introduction, and good morning, everyone. It's my real pleasure here to present to you the findings of our analysis for the state of Alabama and help outline and contextualize some of the challenges that hospitals in the state of Alabama are facing. Okay, so just a minute here before I begin, I do want to mention here up front that as we look at the data that I'm about to present today, what you will see here is the severe financial impacts of Alabama. And it's important to note that the data we are presenting is representative of all hospitals in the state of Alabama, representative of size, geography, rural, urban, and ownership type. And so we believe this is a truly statistical sample and quite representative of the state of finances in Alabama. So to begin with a few key takeaways, the impact of COVID-19, particularly starting in 2020 and leading all the way here through 2022, has leveled immense challenges on our nation's hospitals as well as those in Alabama. And importantly, as we look at these challenges and the headwinds that hospitals face, what we find is that in 2022, in the state of Alabama, it turned out to be the worst year financially for hospitals since the beginning of the pandemic. And to put this into context, even inclusive of CARES Act and other stimulus programs, the operating margins for hospitals in Alabama, the median operating margin declined by nearly 79% from pre-pandemic levels, marking the worst year since the beginning of the pandemic quite significantly. Now, what is driving this? Primarily, it's due to an increased expense load. And what we find in 2022 across all hospitals in Alabama is that expenses rose by nearly $2.6 billion higher than pre-pandemic levels. That's in 2022 alone. And that is nearly a 20% growth in expense, which has greatly outpaced an increase in revenue of 15%, ultimately leading to financial losses. What you'll note is that increase in expense is not only due to labor, but is also on non-labor type items, medical supplies and drugs, which have all contributed to these cumulative impacts. Coinciding with these highly elevated expenses, unfortunately, are that volumes remain well below that of pre-pandemic levels. We find that discharges, patient days, surgical cases, and ED visits are all below their pre-pandemic baselines in Alabama. And unfortunately, while there are fewer patients coming into the hospitals, those that are coming in are staying longer. And we're seeing an increase in length of stay due to patients that are sicker and have more severe health needs, as well as the labor shortages that exist both within the hospitals as well as in post-acute settings, which are preventing the timely discharge of patients from those hospitals. And what you'll note throughout this report is that increase in average length of stay and the inability of hospitals to be able to discharge patients due to those labor shortages in external settings is leading to increased expenses without commensurate increase in revenue. So taken together, what we find is that hospitals faced a profound financial toll in 2022 with no further relief in sight, as much of the CARES and stimulus program have spent the funding that has existed up to this point. And what you'll note is that in 2022 alone, hospitals in Alabama had a $740 million operating loss relative to pre-pandemic levels. That's a 106% decline from pre-pandemic baselines. And across the last 3 years, that totals a $1.5 billion loss in income for Alabama hospitals. And that is inclusive of stimulus funds. As we know, hospitals are working very hard to address these challenges. The operators are making the changes they can, but unfortunately, these are external challenges that highlight the stress that these hospitals are facing. And furthermore, we don't expect many of these challenges to abate in 2023, and we expect that 2023 will continue to be a very, very challenging year, similar to 2022.
Eric, we're seeing your first slide, and that may be fine, but can you make it bigger?
Oh, yeah.
Okay, thanks.
Is that better?
Much, thank you.
All right, thank you for that. All right, so as we began to unpack these findings a bit further here. So when looking at hospital profitability as measured by operating margin compared to pre-pandemic levels, what you find is that those operating margins have declined significantly from 2020 and growing in the declines up to 2022. In 2022 alone, you'll note that the operating margins declined. The median change was minus 79%, marking the worst year since the beginning of the pandemic. You'll note as compared with national medians, while national medians also had declines in 2020 and 2022, unfortunately, Alabama faced even more severe declines than the nation as a whole. It is worth noting that as we look nationally and at other states that have adopted and implemented Medicaid expansion saw lower declines, not as severe declines rather, than those states who did not adopt and implement those types of programs. When we exclude stimulus funds, you'll note that hospital operating margins dropped by more than 100% in 2022. Put another way, all of the margins that hospitals had in pre-pandemic levels were lost and then some in 2022. And when excluding those funds, what you will note is that 2020 and 2021, we saw a decline by nearly 90% in both those years of margin as well. Again, you'll note as compared with the national median, the margin decline in Alabama is far more severe than those experienced nationwide. However, you will note that nationally, these same headwinds and challenges and pressures all hospitals across the country are facing, but those impacts are more profound in Alabama. In thinking about that decline in margin, particularly over the years, it's also important to consider the number of hospitals that are operating with negative operating margins over each year as well. And what you'll note is that in 2022, inclusive of the stimulus funds, half of Alabama hospitals finished the year with a negative operating margin. That's a 125% increase from pre-pandemic levels. It's also worth noting, though, that hospitals typically operate with very slim margins to begin with. And even in pre-pandemic levels, 2019, nearly 22% of hospitals operated with negative margins, highlighting the tenuous nature of hospital finances overall. And I think it's very clearly here demonstrated the impacts that hospitals have faced due to many of these expense challenges and pressures from the pandemic since 2019. Unfortunately, the story becomes even a bit more dire when we exclude any of the stimulus funding. You'll note that more than half hospitals in Alabama operated with a negative margin in 2022. And in 2020 and 2021, those numbers went up by 40% and 48% respectively. Again, these are very, very challenging figures to recognize that more than half of the hospitals, excluding those funds, operated in the red, unfortunately, throughout the course of 2022, further depleting cash reserves and other resources used for reinvestment. So in thinking about how do we translate that reduction in margin to actually operating income losses? What you'll note is that the losses in Alabama in 2022 from an income basis were 106% lower than baseline levels, which amounts to $738 million loss. This is an extraordinary figure. And further, what you'll note is that is compounded with losses that occurred in 20 and 21 as well, with a cumulative income being lost relative to pre-pandemic levels of $1.5 billion. I'll pause on that point because I think if there is one very key takeaway from this report, it's to note that over the last 3 years, inclusive of stimulus funding, hospitals in Alabama have lost more than $1.5 billion in income relative to their pre-pandemic levels. Alabama also faces some other challenges as well. Chief among them, or one item as well, is the fact that the reimbursement rate for Medicare in Alabama is the lowest in the nation. And as such, commercial rates are correspondingly low as well, leading to much of these challenges that Alabama faced since 2020 and predominantly here in 2022. When we exclude the stimulus fund, so understanding what the operations were without any of that supplemental support, you'll note the staggering losses that hospitals faced from these external pressures. This amounts to a total of $936 million lost in 2022. That is a 135% reduction in operating income from pre-pandemic levels. And cumulatively, over the last 3 years, $2.4 billion lost in income, truly staggering figures for the state of Alabama and the hospitals. So what is driving this? I alluded to it earlier that expenses are the primary challenge and driver to many of these losses. So I'd like to go through and unpack some of these causes in a bit more detail. So when thinking about the total expense increase for hospitals in Alabama over the course of the last 3 years, you'll note that in 2022 alone, expenses for hospitals in Alabama increased by over 20%, totaling $2.6 billion above pre-pandemic levels. So a 20% increase in cost. And as we'll show, those costs are labor, non-labor, contract labor, drug expense, medical supplies, and others. And unfortunately, no areas of the hospital are immune to many of these inflationary pressures and challenges from the external market to expense increases. So a little greater than half of that total increase in expense is due to increases on the labor side. Labor typically amounts for a little over half of the expenses at hospitals, and surely enough, a little bit more than half of the expense was being driven by increases in labor expense. This totals $1.4 billion higher than 2019 levels, and is nearly 30% above pre-pandemic levels. This, again, 30% increase in labor expenses over 2019. And you'll note as well that these expenses have increased year over year since 2020, from 3 to 18 to 30%. So significant growth occurring here. Of that $1.3 billion increase in labor expense, 1 billion of that, so nearly 75% of that, is increases due to employed staff and labor. This is important. It demonstrates Alabama's hospitals working actively to ensure that their own staff are compensated fairly and employed appropriately. But in doing so, you'll note that the employed labor costs have gone up by nearly 35% over the last 3 years, with $1 billion increase in salaries and wages and a $75 million increase in benefit expense over this same time period. And these represent the vast majority of hours being worked within each of these hospitals, generally 90% or more of the hours by employed staff. Of the remaining difference with labor expense growth, much of that here is due to contract labor expense. So contract labor expense costs in 2022 in Alabama exploded, with those labor expenses rising nearly 450% above pre-pandemic levels, totaling $324 million. Nationally, we also see these contract labor expenses rise nearly 450%. And it's important to note here that this is being driven by two factors. One is the utilization of contract labor to care for patients, particularly during periods of fluctuating demand, has risen both in Alabama and the nation. And further, the prices at which staffing agencies are commanding or demanding for these types of services has also increased. And in both cases, they have roughly doubled over pre-pandemic levels, leading to this 450% increase. I also think it's notable that while contract labor comprises generally less than 10% of the total workforce in terms of hours, it's contributing nearly 25% of the growth in expense in 2022 on the labor side, highlighting that incredible elevation of wage rates and utilization for those types of positions. As I alluded to earlier, as sicker patients are coming into the hospital and as those patients are staying longer in the hospital, what we note as well is that non-labor goods and supplies have also increased in expense over this time period, with the most significant jump in 21, and unfortunately in 2022, continuing that growth to an increase of nearly $82 million across the state, or a 17% increase in medical supply expense alone. As you all may be aware, there are a number of challenging factors here that are driving these medical supply expense increases. This is both the cost of medical supplies being impacted by supply chain disruptions, increased demand for PPE, equipment and requirements, inflationary pressures overall are contributing to some of the growth on medical supplies, again, leading to a 17%, a double-digit growth in these types of expenses. And further, as patients stay longer and they are sicker, they require more supplies, goods, commodities, as well as therapeutics to take care of them appropriately. So along those lines, as we look at drug expenses, what we find is that drug expenses have also increased dramatically since pre-pandemic levels, with the peak growth occurring in 2021, but continuing growth in 2022 of nearly 14% over pre-pandemic levels, totaling a $61 million increase in drug expense. It's worth noting here that much of the increase we see in 2021 is due not only to the backlog of patients from the prior year who may have postponed or delayed care and coming in sicker, but it's also due to the fact that as those patients come in, particularly those with chronic conditions, they required more and more expensive types of drugs and pharmaceuticals to care for them, leading to that spike in 21. But unfortunately, as the acuity of these patients have risen and the time in the hospitals has increased, we continue to see growth in 2022 as well. And these same trends have seen a larger increase in 2021 in drug expenses, consistent with what we are seeing nationally as well. So I've alluded to it a few times that hospitals are seeing fewer patients, but they are sicker and staying longer. So I'd like to unpack that in a bit more detail. So overall, when comparing volumes relative to pre-pandemic levels, what you will find in nearly all cases that they are below their normal run rates. Discharges are down nearly 3% from 2019 pre-pandemic levels in 2022. Patient days are down by 2%. Now, what's notable is while the discharges are down to a greater degree than patient days, that means that average length of stay has increased. And you can see that average length of stay how long the patient is staying in the hospitals has increased by nearly 6%. Again, this is really, really critical. Part of the challenge here is not only that patients are sicker that are coming to the hospital and requiring more expensive treatment, but further, the labor challenges and shortages that exist in post-acute sites of care are inhibiting hospitals to discharge these patients in a timely fashion and find placement for them, ultimately leading to increased expense, as hospitals are not necessarily paid for each additional day that a patient stays in a hospital, but do incur expenses for each additional day, ultimately leading to some of the losses that we discussed early on. Additionally, what you'll note is that surgical cases are down quite significantly, minus 4% in 2022. And what is driving this primarily is patients choosing to access care outside of the hospital or in different areas. Ambulatory surgery centers being an example of this, ultimately pressuring and stressing hospitals' finances from being able to deliver this type of care as those patients choose to receive care in different areas. Along those similar lines, you'll note that ED visits are also down by nearly 3% from pre-pandemic levels, as again, patients chose to access care through other sites, which may include urgent care centers, retail pharmacies, and as well, perhaps delayed or postponed care. What is notable and not shown here is that while the visits to the ED are down, the populations of patients visiting the ED has shifted such that there is a higher proportion of self-pay, uninsured or underinsured patients. And further, there's a greater share of psychiatric patients visiting the ED as well, further stressing hospitals' ability to deliver that care and leading to a quite challenging situation. What you'll note as well is as we track the ED visits relative to COVID cases over the last 3 years, you will note that the ED volumes did trend upwards as COVID cases began to rise throughout the state. However, what we note as well as I mentioned that we are seeing that the types of patients coming into the ED have shifted. And while COVID is not necessarily the primary driver of those ED visits anymore, it does not mean that the pressures in the ED have lessened, but instead the fact that we're seeing sicker patients, underinsured, uninsured patients, and psychiatric patients, that shift has led to an increased stress in the ED as well. And cumulatively here, we are seeing, as I mentioned, a slight decline in ED volumes relative to pre-pandemic levels. Very challenging conditions. So what does this ultimately mean? What is the financial toll faced by hospitals across the state of Alabama when thinking about this in totality? Well, importantly, it's worth noting here that as I mentioned, hospital expenses have grown significantly faster than any growth in revenue. And as such, what we find in 2022 alone is that the income being generated by hospitals dropped by $740 million, or a 106% decline from pre-pandemic levels. You'll note, however, in 2020, 2021, and 2022, there were losses relative to those pre-pandemic levels in income, such that the cumulative impact of all of this is nearly $1.5 billion, inclusive of those CARES funds and other stimulus programs, while those expenses have risen by nearly $2.6 billion. When you exclude any of those stimulus funds, you can see the true impact of these challenges and headwinds that hospitals face. And what we find is that in 2022, the reduction in income was nearly $936 million relative to pre-pandemic levels. That's 135% reduction. In total, nearly $2.5 billion reduction in income over this time period, given this extraordinary growth in expense, which greatly outpaces the growth in revenue. It's worth noting too that when you are in these prolonged conditions of negative operating margins, negative income, and others, it stresses the hospitals not only from an operating perspective, but from a balance sheet as well. And certainly hinders the ability for hospitals to reinvest appropriately in themselves. So unfortunately, across the state of Alabama, what we find is that the situation is quite dire. Unfortunately, Alabama has fared worse than the country as a whole due to many of these external challenges that hospitals are facing. And while hospital leaders put care of the patients and community at the paramount amongst all of this, you will note here the level of financial impact that the pandemic and these external headwinds have had on hospitals. So with that, I will pause here as the overview for what we found in Alabama relative to other states and relative to the financial impact since the beginning of the pandemic. Thank you.